He works to face violence head on. A new director is taking over the Office of Violence Prevention here in Louisville. It comes as a critical time. Madison Elliott sat down with James Tatum to talk about his new role and his plans to address violence, especially among young people.
A new director recently officially took over the Office of Violence Prevention, and he tells us they're focused on expanding the programs they know are working and getting the word out about what they're doing. Now sitting in the director's seat is James Tatum. After serving as interim director since April, Mayor Craig Greenberg officially appointed Tatum to the role this summer.
I've been volunteering since I was 13. So being able to engage in something like this, using the skills that I have to support something like violence prevention, it's extremely important to me.
Tatum helped oversee the rebrand from the Office for Safe and Healthy Neighborhoods to the Office of Violence Prevention. He says under this new name, the office is widening its ability to refer people, especially in cases of domestic violence or suicide.
So if we meet somebody who needs those resources, we can also help them get the help that they need as well.
But violence interruption and prevention remain key. He says 3 years ago, the office launched multiple pilot programs which are seeing success. In fact, he says June was the city's least violent June in 11 years. His priority is continuing to pour into these proven programs, like their anti-violence coalitions and community violence intervention sites.
It's community-based. It's a lot of one-on-one mentoring. And then on the prevention side as well, we're continuing our youth engagement.
He says while crime is going down across the city, kids younger and younger are getting involved in violence.
So that's something that we want to make sure that we're addressing and making sure that we're starting that prevention as early as possible.
But the biggest problem his office runs into, a lack of knowledge of the resources that exist. He says they need volunteers to step up too.
So violence prevention, if we treat violence like a public health issue, almost like a disease where we're trying to treat it, we're not only treating the causes, we're treating the symptoms, and then we're trying to prevent it in the future as well.
Madison Elliott, WLKY News.